Hi. Dr. Binita is a consultant respiratory physician and honorary senior lecturer at the University of Manchester in England. She is a member of Independent Sage and a champion for the charity Long COVID Kids. We're really pleased to have you today.
What can you see? Can you see my presenter view or the slideshow view? Could you see anything?
I do see your view. I see
Taj Mahal.
It looks like a working view, not the presentation view.
Okay, let me just stop sharing my screen just for a second. Okay, let me just try something else.
Thank you. Take your time.
Is that working?
If you just play, oh, I see, it's overlapped. Interesting. We have your slideshow behind your PowerPoint program.
Okay, right. We're getting closer then. Just 1 second. Let me just try something else. How about this?
If you click play from start, what about use slideshow?
I don't understand. So when I'm sharing my screen, it's coming up as, okay, so you can see that.
Yeah, this isn't bad if you want to play it like
can you see that?
View from this
view,
use slideshow. Switch view.
Have we got it?
There we go.
There you go.
Got it. Amazing. Right. Okay. I'll try and shave a minute off to make up for that. Sorry about that.
Thank you so
much. So I just want to thank Claire for and also Robbie for just beautifully kind of saying a lot of what I had planned to. So I'm going to share a personal journey. It's not about me, actually. It's about my daughter, Jasmine. And she overall has been ill for about 18 months with long COVID. Now, she was 10 years old when she first got ill. And before she got ill, she was just a normal, healthy, happy 10-year-old. She loved doing gymnastics. She loved swimming and just being active. And she had no health problems. The first 12 months of the illness was really difficult. She was plagued with lots of different symptoms. She had a lot of symptoms we've already discussed: severe fatigue. She needed a wheelchair for long distance, and it affected every part of her life. And she could barely go to school, and she really lost everything. I'm pleased to say that over the last 6 months, there has been a steady but slow but steady recovery. And we've got her to the point where she's now back at school full time. And I'm going to just talk a little bit about how we got here. So just to go through the timeline, as I mentioned, the initial illness was in January of 2021. And a bit like Claire said, she got ill with a pretty mild illness, but just never got better. So she was left with fatigue. And about 3 weeks after the initial illness, she developed very severe abdominal pain, was rushed into hospital. I thought she had appendicitis, had all the tests. And like we've discussed, the tests all came back negative. At this time, it was lockdown. She wasn't going to school and was dipping in and out of online lessons. So she was resting a lot. And the real turning point was when school started again in the March, and she went back full time, even though she wasn't quite right. We felt that was the best thing. And in hindsight, what then happened was this now what I understand is a boom and bust cycle. She would go in, it would just be too much for her. Then she would crash. And this would happen every 10 days, 2 weeks, she would have a crash until about the April when she got really poorly. And this is when we got her assessed by pediatrics. And I'm a doctor, so I'm able to access healthcare quite quickly, because one of my colleagues in the hospital saw her, which we were really lucky. But she had this whole raft of tests and they all came back negative. And so they said, well, she's got MECFS, go off to the clinic. We then decided to focus on her health and removed her from school. And that was a really difficult decision. We then waited several more months to get into the MECFS clinic while she was just ill and at home. School attendance at this point was about 20% because she could go in maybe an hour 3 times a week, if that. And we went to the clinic, and now we're getting towards sort of September, October, and we were offered physio. And we followed the advice, but unfortunately, the advice led to her crashing further. And at this point, we disengaged from the clinical service, from the NHS. Everyone was very nice, but we were despairing that our child was very sick and we weren't getting any help. And so at this point, I say we go a little bit off piste. I had started connecting with international researchers, people like Risho, who's going to be on the call, on the webinar later, but other people in Germany, South Africa, elsewhere. And we started looking at alternative treatments based on the science and based on what we know. Now, because I've only got 10 minutes, I can only focus on one aspect. So I'm going to focus on the thing that really made the biggest difference for us. And that was in February this year, we flew over to Germany. And this here is Dr. Bearta Jaeger, who is now quite famous in long COVID circles. So we went to the Mulheim clinic. This is Dr. Asad Khan, my very good friend and colleague who helped facilitate that. And you can see Jasmine's in a wheelchair. She's looking pale and withdrawn. And we had her blood test done, her research blood test that you can't get on the NHS, or as has been mentioned, is only available in a few places in the world. And she had microclots. And these are her platelets, which were extremely clumped together and very, very abnormal. Now, why does it matter? What is this clotting, abnormal clotting doing in children? We don't know is the answer, because hardly anybody is looking. You know, there is a real dearth of research in children, but there is this one study which came out of Germany. It's a preprint, it's not yet published, but they looked at 54 children with COVID, half of whom had recovered, half of whom had long COVID, and 9 healthy controls. And what they found with this very specialized MRI testing was widespread defects when compared to the healthy children. And what was really worrying is even in the children who'd recovered, they also had these defects in the lungs, which we think were caused by clots. So there's something here about actually just having COVID, even if you recover, can leave some damage, which is quite worrying when it's our children we're talking about. And there is overwhelming evidence from the adult world now that a very key underlying mechanism in long COVID is the inflammation of the blood vessels. It's not the whole answer, but it's a big piece of the puzzle. It's a thrombotic vascular disease, so blood vessels and clotting. And the virus, it replicates in cells, and it's postulated that it's carried outside of those cells by these little extra cellular vesicles, and it's transported around the body, and then through various different interactions, it can cause injury to the blood vessel wall, which can cause the clotting. And platelets are also very important in this. They become hyperactivated. And so you then end up in this vicious circle where you've got the clotting, the platelets, and that causes more injury. So you end up with this thick, sticky blood, which can't get through the capillaries, can't give oxygen to the major organs, particularly the muscles. That can cause this chronic sort of low oxygen levels and be one of the mechanisms for the fatigue. But as Claire and Robbie have talked about, there's also other mechanisms that can result in the fatigue as well. So I don't have time to go through this in detail, but these are some of the treatments that we have sequentially tried over 6 to 8 months. We've been to Germany 4 times since February at quite a lot of expense to tweak the combination of things, but we have used sort of some of the simple stuff like the supplements and the vitamins that's for inflammation. Pacing and energy management has been key. Melatonin for sleep. Claire mentioned the vagal nerve and the autonomic nervous system. So there's been some stuff we've done to try and counteract that sympathetic overdrive, that fight or flight. But actually the thing that has made the biggest difference has been blood thinning treatment and antiplatelet therapy, which again is really not used routinely in children and needs supervising and monitoring. That's very important. She's also had some of the probiotics for the gut, and more recently been started on a drug that will stabilize the endothelium and, you know, dampen down some of that blood vessel inflammation. And I must stress, this has been me as a consultant with advice from world experts at every step. I've got an Italian pediatrician, South Africa, Germany, and others where we have sort of all discussed how we manage this. And what I really want to do now is bring this research and bring this treatment to other people. And what has worked for Jasmine may or may not work for another child. And that's what we really need to understand. But here she is on our summer holiday, first family holiday in 3 years. She was able to swim, and now she's back at school. She started high school in September, and she has so far managed full days. Apart from doing PE, you wouldn't know that she was ill. And she remains on a lot of this therapy. And the biggest challenge now is how we start weaning her off it and how long. So my take home messages.
We're out of time, Dr. Binita.
We're out of time.
Yes.
That's fine. That's my final slide. Key points. There are treatments. You just need to be able to access them. And we need research.
All right.